There's been good news this week for Australians living with a rare and life-threatening blood cancer. As of yesterday, a treatment for myelofibrosis is now listed on the PBS. Here's Richard Vines, Chairman of Rare Cancers Australia. So Richard, firstly, how many people in Australia suffer from this condition?
It has an incidence of around 4 per 100,000, which means about 900 people to 1,000 people a year are diagnosed with it. Ros?
And it's life-threatening?
Absolutely life-threatening. The median survival is between 2 and 10 years, and importantly, the symptoms during the time when you're suffering the disease are quite extreme. Enlarged spleen, bone pain, fatigue. You can end up, in fact, with a spleen weighing 10 kilograms. So this drug is great news. It offers relief from those symptoms and does have an extension of life, but more importantly, or as importantly, it has an extension of quality of life.
Yes, and so being listed on the PBS, how much cheaper does it make this drug now for people?
Oh, essentially it drops from something in the order of $7,000 to $10,000, I'm not sure exactly of the price per month, to $37 per month. It's a world of difference. There were compassionate programs in place by the company that supplies it, but that only reaches a small percentage of patients. So it's a great breakthrough for these people. Yeah,
and was it a battle to get this drug on the PBS?
Well, yeah, and whilst it's good news, it's worth reflecting that this has been going on for 3 years since the first submission was made to get it on the PBS, and it was in fact approved by the PBS 12 months ago, and for reasons that are not at all clear, there's been a delay of 12 months effectively from the time the PBS said it's okay to go until we actually get it in the hands of patients, and that's a lot of patients that have missed out in that time.
Yeah, it is the old argument though, Richard, when there are limited funds you have to allocate the most money to more common cancers because you're going to be helping more people, simple as that.
Well, I don't know that actually fits. It's like you still, the unit cost per drug, the $7,000 a month doesn't change whether it's rare or whether it's common. It's still one person. That same person has worked hard, paid their taxes, contributed to society, and at the time that they get sick, just because they're rare doesn't mean that we should turn around and ignore them. The problem's not the cost, the problem's the process, and the process demands large samples of data across large patient populations, which are just impossible to produce.
And how many other medications for rare cancers are going through the process now to be listed on PBS?
We're doing a study at the moment, which we'll be releasing in March, but we've gone back over the last 6 years, and to be absolutely blunt, the number of medications that are available for rare cancer patients, you can probably, that have been recommended through the PBS in that time, you can probably list on one hand.
All right, Richard, thanks so much for coming to talk to us.
Thanks, Ros. Appreciate it.